Thank you for joining us for this COVID-19 telephone town hall. If you'd like to ask a question, simply hit *3 on your phone and an operator will come and take your question. If you're listening online, you can type your question into the question box on our website. We are just beginning to dial out to households across Arapahoe County and want to give folks a moment to join the call. My name is Erica, and I'll be your host tonight. Our goal is to bring you the latest information about school district reopenings across the county, to discuss what to expect in the coming weeks, and to answer any questions you have about how our schools are handling this crisis. We also have medical and mental health experts on hand to provide information in those areas that can help keep you and your family as safe and healthy as possible. This week, in addition to our regular hosts from the Tri-County Health Department, we're joined by representatives from AllHealth Network and from 6 school districts across the county. Before we meet our guests, a reminder again, if you would like to ask a question, you can press *3 on your phone or send your question through the website. To get things started, we'd like to welcome Arapahoe County Commission Chair Nancy Sharp.
Thank you, Erica, and thank you all for joining us tonight. We know that you have a lot of questions and concerns about how our school reopenings are going, and we're pleased to have education officials here with us tonight to talk about the status of their districts. So we're glad to and really appreciate, I know this is the second call we've had with each one of them, and we do really appreciate you joining us tonight. I'll keep my remarks brief, and thank you again for joining us. Before we get to our school officials, I'd like to introduce my fellow commissioner, Kathleen Conti.
Thank you, Commissioner Sharp, and thank you all for joining us tonight. As you know, when it comes to combating COVID, just like when you buy clothing, one size never quite fits all. And this is why we're pleased to have such a broad representation of our school districts on this call. And whether you live in Aurora, in one of the southern suburbs, or in the Eastern Plains, you'll get valuable information tonight about what the school districts closest to you have been doing so far this school year and what they're planning to do in the coming weeks. Now I'm going to turn it back over to the moderator so we can get rolling.
Thank you, Commissioner Sharp. And now we'd like to bring on Dr. John Douglas, the Executive Director of Tri-County Health, for an update on the newest public health orders. Welcome, Dr. Douglas.
Yeah, thanks very much. Great to be with you this evening. Let me give you an overview of the public health order that we've been really focused on recently. It came out about 4 weeks ago. This was one of many updates that have come out because the state's been quite busy trying to fine-tune the guidance, or really the orders that they create. The latest one was important because it included a modification of the thresholds by which counties are allowed to have certain kinds of capacity for community entities. And by that, I mean businesses and public gatherings and churches and retail stores and personal services business like barbers. It also provides guidance, albeit not quite as strongly worded as the requirements for businesses, et cetera, for our schools. So we're operating under that order right now. It's divided into 5 levels. The levels are determined by 3 criteria. How many cases do you have in your community? Your case rate adjusted for your population. The second is, what is the rate of test positivity of tests that are being conducted in your county? And the third one is, are your hospitalizations going up or down? Let me say that the one we've been focused on most recently is numbers of cases. And if you've been following the news, you know that like the metro area and like Colorado and like the U.S. and frankly, like most countries in what we consider to be the Western world, we are seeing increased cases. We are experiencing what many folks described as a potential fall surge because Colorado experienced a blip in the middle of the summer that some call the second wave. Some people are sort of thinking about this as maybe being a third wave. Now, Arapahoe County has been designated as being in level 1 of the public health orders, the dial. Since about 2.5-3 weeks ago, our rates went above what allows us to be in that level 1 area. And the county has been working on what's called a mitigation plan to try to help us turn the corner and bring cases back down so we protect our health, so we can keep our businesses open, and so our schools can thrive. The key number that we've been following, again, is the incidence rate. We need that incidence rate to get down to 75 to stay where we are. And recently it's been going in the opposite direction. As of this afternoon, it's at 185. So a lot above that level we'd like to get to. And overall, our cases have gone up by about 17% in the last 2 weeks. The complementary statistic in terms of test positivity for the county is currently 7.7%. We want that number to be less than 5%. So we're concerned about that. When that number gets above 5%, it says pretty unequivocally the increased number of cases you're seeing is not due to just a lot more testing. It really does mean more transmissions happening. The semi-bright spot in the horizon is that the indices of severity, how many people are being hospitalized and how many people, worst case scenario, are dying, remains fairly low. There's been a slight uptick in hospitalizations, and there's been no change in our death rate, which is very encouraging. But the order does pertain to all counties, and we're going to have to carefully work with the state and work with our partners in our community to see if we can effectively bring that down. I will note in closing that when we look at our case investigations, and what that means is if somebody tests positive for COVID and we talk to them and say, tell us about what happened to you, where were you exposed, the most common thing we're hearing about in the last month in Arapahoe County is personal gatherings. It's not restaurants, it's not bars, it's not hairdressers, it's not going to football games, or going to school, by the way. It's going to personal gatherings. And the message of that is if we want to all see our rates turn around to maintain our health, to keep our businesses and churches open, and to keep our schools safely open, we've all got to kind of work together. And the things we do to work together is to acknowledge that we're fatigued and sick of this whole COVID thing, but we've got to hang in there a while longer. And hanging in there a while longer includes wearing masking when you're around other people, social distancing when you're around other people, avoiding crowds, staying home if you're sick, testing if you have COVID-like symptoms, because otherwise we can't really control the spread in the community. Keep a low profile if you are at risk, if you're older, or if you have underlying health conditions. And then if you do test positive and the public health department calls you, please cooperate. Please answer the phone. Please tell us what's happening. We don't want to badger you, but we do want to work effectively to keep our community safe. It's in our hands. We've got great, smart, responsible residents in the county, and I know if we all pull together, we can get this done. Thank you.
Wonderful. Thank you, Dr. Douglas. And if you are just now joining us, a reminder that if you would like to ask a question, you can press *3 on your phone, and you can speak with one of our operators, get your question in the queue for the evening. Okay, now I would like to introduce Amber Behrens from AllHealth Network, who will give us some information about the mental health services that her organization provides. Amber?
Thank you, Erica. So I am excited to be here tonight. Thank you. We are excited to share with you that we have a free community resource to assist with the stress of the pandemic. It's called the Colorado Spirit Program, and it's available to anyone in the community, and it's really just here to provide both group and individual support. We can be reached at 720-707-6789. We have a webpage at allhealthnetwork.org/ /Colorado-Spirit. And there's a bunch of coping tips and resources and a list of events there. You can also contact us through a contact form there. But we're really here to be a support because we know everyone, parents, kids, staff at schools, administrators, everyone is feeling the stress, and we are here to help support people in figuring out what would be most helpful. Thank you.
Great. Thank you, Amber. And before we get to your questions, we'd like to have each school official introduce themselves and talk briefly about where their district is right now, about 6 weeks into the school year. Let's start with Superintendent Rico Munn of Aurora Public Schools. Rico, go ahead.
Good evening, everybody, and thank you for having me. Everyone hear me all right?
We hear you great, Rico. Go ahead.
Great. The Aurora Public Schools, we're excited to have the kids back in our buildings. We started gradually this year. In mid-August, we started having special groups brought into our buildings, particularly our students with special needs and some of our newcomer students. And then over the weeks, as we got more experience there, we ramped up and brought back our preschool and kindergarten kids. And then this week, we have started first through eighth grade in a hybrid fashion. So we have both A groups and B groups coming into our buildings. This week we have the A group. Next week we'll have the B group. And then we also have a portion of our families who have opted to stay fully remote throughout the year. We'll be welcoming back our high school students in the middle of next week. That's our plan for right now. We, of course, are very concerned in watching the rising numbers, as Dr. Douglas talked about. In APS, we are 80% in Arapahoe County and 20% in Adams County. And so we're watching what's happening in both counties. We have placed the district on a watch status, meaning that we wanted to make sure our families were aware that we are watching these numbers very closely. And if we are not as a community able to take measures to bring those numbers down, then we may have to shift back to more remote learning. And so we're really working hard to work with our community, to work with our public health officials to try and get those numbers back in check. And happy to talk with you more about that tonight. Thank you.
All right, now let's go to Tom Terrell, the superintendent at Byers School District. Tom, go ahead.
Thank you for having me this evening. In Byers, we're a much different look than our urban counterparts. We've got 550 kids, K-12, all on one campus. We still have all the same restrictions that the urban areas have. Our incident rate is definitely not as high just because our density of population. However, we've been conducting face-to-face instruction 5 days a week from preschool all the way through 12th grade in cohorts in the elementary and in face-to-face at the secondary with face covering, social distancing, and increased sanitation occurring. Our biggest challenges have been around lunch, splitting those up so there's not as many kids in the lunchroom. We've got different areas where the kids are eating, and also transportation. That's definitely been a challenge for us as well, not being able to run as many routes just because of the lack of drivers. We must remember that whatever we put in place here in our environment, in the educational environment, when the students leave the building, whether it be at the park playing a pickup game of basketball or at the McDonald's, they're with other area students, and they're certainly not social distancing. And so we're up against that as an obstacle, as I'm sure everybody else is as well. We have more concerns around the effect of the mental health at this time of our students. There's a fear that of students and staff that they're going to be the one that causes us to shut down, and it's very disturbing that is a fear. And so we work with that as much as we do in providing a safe environment. And so thank you again for having me.
Wonderful, thank you. And next, let's hear from Scott Siegfried, the superintendent of Cherry Creek School District 5. Scott, go ahead.
Well, good evening, and thank you for the opportunity to be here. I'd first like to start just thanking and recognizing my fellow superintendents for all the work and all the partnership that we've supported one another frequently throughout this time to truly meet the needs of our communities. I'd also like to thank Dr. Douglas. He has just been an extreme, really great support for all of us through this time as we've learned a little bit more about public health and how to support kids being in school safely. In Cherry Creek, we have finished our first quarter of school. We opened up a full online school for those individuals that needed to make that decision. We had a little over 10,000 students enroll in that school, K-12, and we've had the rest of our students, about 45,000, in school since early August. Our elementary students have been in school 5 days a week for those first 8 weeks. And then our hybrid model at the middle school and high school was utilized to create more social distancing. Just a few other items to highlight real quick. I'd also like to share that what we're finding in our first quarter of school is that sometimes COVID is brought into schools, but it is really not being spread in schools. The multiple overlapping safety strategies that we have all implemented are working. Schools are relatively safe compared to everywhere else in the community. And again, as my colleagues have said, and the rest I'm sure will, we are all very concerned about what's happening in Arapahoe County and want to do everything to make sure our kids have the opportunity to come back in person because we think that's the best place for them, given it's a safe environment. Thank you.
Great. Thank you, Scott. And just a reminder for everyone that has joined us, if you have a question this evening, you can press *3 on your phone. You can get into the queue and ask your question live this evening. So again, that's *3. Okay, next we have Wendy Rubin, the Superintendent of Inglewood Schools. Wendy, go ahead.
Hello? Can you
we
hear
can
me?
hear you great, Wendy. Yes, go ahead.
Oh, great. Okay. Sorry, it shows that I'm still muted, so I was confused. So good evening. Thanks for including me in this conversation. I think that this is a great way to reach out to a lot of families and help people across Arapahoe County have a better sense of what's going on in all of the school districts. In Inglewood, we are completing our 9th week in school, and we're just so grateful that we were able to bring about 60% of our students back for in-person learning. They and their families chose that option. We have just about 40%, a little bit less than that, who have chosen full-time online. We have teachers in classrooms, virtual or in person, that are teaching. We have students that are learning. And our community has really, really come together and has done a wonderful job of making sure that as far as the schools are concerned, that they're following the safety protocols around mask wearing, around distancing. We've had to roll out several cohorts. We keep our kids in cohorts. We've had to roll several cohorts out into quarantine situations because of positive cases that have come into the schools. And everybody has just been extremely good-natured, positive, grateful. They really, really want to have the stability and consistency of school for their children and for their families, and they're working really hard as far as the schools are concerned. But again, I cannot emphasize enough how important it is that we get these community numbers down. We made assurances with our Teachers Association and our community that we'd be watching the data closely, and if data started to show that it was not a great idea to have kids in school, that we would need to reassess that. And we really are coming up at that point very, very quickly. So, along with the fellow superintendents who are on this call, we implore that our community really get back to some of those practices that we know helps to stop the spread. Keeping close to home, limiting outside contacts from your family, wearing masks, staying socially distant. We have to turn this around. Otherwise, we will be looking at having to shut our schools down. Thank you.
Great. Thank you, Wendy. And next we have Brian Ework, Superintendent of Littleton Public Schools. Go ahead, Brian.
Good evening, Arapahoe County. Like the others, I too would like to thank the staff at Arapahoe County and all of our county commissioners for providing us this opportunity just so that we can answer questions for our citizens of Arapahoe County about what's really going on inside of our school districts. Restarting our school in the middle of this pandemic, it's been a tremendous challenge for us, and there's been many complex issues that we've had to overcome, not to mention the many polarized views within the community as to what we should be doing and how we should be doing it. And so the approach that we've taken in Littleton Public Schools has been one that is aligned with our state and local public officials and Colorado Department of Education, the governor's office, and we also have a community task force. And we're also trying to balance that with student, staff, and community safety, while at the same time trying to get kids back into school as much as possible. And then also offering a fully remote option for families and students like the other school districts for those who are simply uncomfortable with in-person learning. All of our LPS schools and programs and facilities, we have extensive overlapping health and safety protocols in place to prevent the spread of COVID-19. We're doing the masking, the physical distancing, screening. We have directional signage in our hallways and other spaces, hand washing, hand sanitizer protocols. We have online meetings when we can. We have free COVID testing for our staff, and we also do case identification and tracing when necessary. And then, of course, quarantines using the requirements that have been set forth by Tri-County Health. For our models of learning, we have full in-person learning for all of our elementary students, and we have a hybrid blended model for our middle school and high schools. And basically the purpose of that is to divide the number of kids in our schools at any given time in half. We've also provided all of our LPS teachers with training on how to immediately pivot to go to online should they have to be quarantined either in small groups or entire classrooms or entire programs or even entire schools if we have an outbreak. So we also have a fully online program that I mentioned. We call it TOPS, Temporary Online Program, and it's serving 1,600 kids. It's actually the second largest school now in Littleton Public Schools. A program like that, starting from the ground up, we did not have an online program before. It's been quite a challenge and actually quite expensive for us as well. We're also following and tracking specific COVID-19 metrics and case rates within Arapahoe County along with all the other districts. And just recently we've added 2 additional metrics that include active LPS staff COVID cases and also our LPS student COVID cases. All of this information can be found on our website, and all of the letters that we've sent out to our community are also there as well. So currently, LPS, as of tonight, we've had 41 positive cases. And like the other school districts, we are doing a great job inside of our school buildings containing COVID. None of the cases that we've had were transmitted or contracted within the walls of any LPS school. Additionally, all of the staff and students that we've had to place in quarantine over time, not one positive case has emerged from quarantine, and so that's also good news. And based on that data alone, I'm convinced that masking and our other health and safety strategies that we're using, they're actually working within the walls of our schools. So I do look forward to the questions this evening, and like the other superintendents, I also would just really ask Arapahoe County citizens to stay masked and follow the protocols so that we can keep our kids in school where they belong. Thank you.
Thank you so much, Brian. And just a reminder again for all of those listening, if you have a question for any of our superintendents this evening, or even Dr. Douglas, you can press *3, that's *3 on your phone keypad. You can get into the queue and ask your question live. Next, we have Patrick Santos. He's the superintendent of Sheridan School District. Patrick, go ahead.
Thank you very much, and thank you for everybody for hosting this tonight. Dr. Douglas, appreciate you more than you know. Appreciate your time and your energy committed to us. At Sheridan Schools, we began school on August 17th and are now finishing our 9th week of in-person and hybrid instruction. We continue to grow and learn and figure out ways to make this work. We continue to offer the choice of in-person or remote learning to all of our families. Our kids K-5 go to school 4 days a week, a full day of instruction. And 6-12 go half day with their core academic classes, language arts, math, science, and social studies, either in the morning or the afternoon, and then their electives are remote on the opposite side of that. So that continues to be fairly successful for us. We have had a few bumps in the road, just like all of our colleagues here. I want to repeat what Mr. Ework said, Brian Ework, that the student-to-student transmission in our schools are almost non-existent, as are student-to-adult transmissions to this point. Most of it is coming from outside on that. So if we can continue to work to mitigate this through the hand washing, through distancing, and masking appropriately, I think it's going to make a huge difference for us. We hope to continue that. We're very, very concerned about what's happening in Arapahoe County with the numbers right now. That's something that we pay very, very close attention to, and I know my colleagues and I speak quite frequently on conditions, so that's something that we'll pay attention to. We really, really do need support from the entire community to help keep these numbers down. With that said, I think that's all we have. I probably covered everything that my colleagues have covered as well. Thank you so much.
Thank you, Patrick, and thank you everyone for all of those updates. We are now going to go ahead and take some live calls. Again, if you would like to ask your question, just dial *3 on your phone to get connected to an operator. Our first caller is Sharon, and Sharon's in Aurora. She has a question for the Superintendent of Byers School District, Tom Terrell. Sharon, you are live. Go ahead and ask your question. Sharon, can you hear us?
Yes. Can you hear me?
Yes. Go ahead and ask your question.
Okay, good evening. Is Tri-County considering making a mask mandate for all schools in Arapahoe and Adams County schools? The bigger school districts require K-12 students to wear masks to protect staff, students, and others during the upcoming COVID flu season, but the smaller school districts are not requiring all students to wear masks. We know masks help prevent the spread of COVID. Why wouldn't we do everything we could to protect everyone in the schools?
Thank you, Sharon. Again, this is Tom out in Byers. So I am in one of those smaller districts, so I appreciate your question, and we hold the same concerns. One of the things we did is we are following the mask mandate for 10 years and above, and I think you're saying that you'd like to have masks all the way through. We've got 100% participation in wearing masks for 10 years and above. But one thing that we did for the 5 to 10-year-olds to make it enjoyable, I guess, to say the least, is we did buy the face shields for those, and they've been able to decorate them and make those into an activity that they enjoy. Some of the younger kids are feeling like they're Star Wars characters, so that's been kind of fun for them. We've also, to build off of that, we got about 50 classrooms and office spaces. We've got UV filtration systems there for the air that we're pretty happy with. We're seeing less allergens than we typically do in this time. Of course, the smoke's not helping anything, of course. We've also got some UV room sanitizers that we've been taking around in the evenings and sanitizing the rooms with the UV light, as well as the sports equipment, so we've been happy about that. We also have a lot of outside spaces that we've got classrooms set up outside, so we're able to get outside and utilize the fresh air. Our music classes are outside, our art classes are outside, and of course our PE is outside as well. So thank you again for the question.
All right, wonderful. Next we have Barbara, and this is directed towards Scott Siegfried with Cherry Creek Schools. Barbara, you're live. Go ahead and ask your question.
Yes, I have a question about the hybrid programs that Cherry Creek School District has implemented in the middle school and high school. My family has found that the online experience on the 2 days that they're not in the school is woefully inadequate, to the point where we are seriously considering checking out total, complete homeschooling. I want to know if there is a plan to transition from the hybrid programs into full-time school, and if so, is that something that will be happening before the end of the year? Thank you.
Well, thank you, Barbara. I did get that question quite a bit from community members when the data for Arapahoe County was much better than it is now. That is something specifically that comes from health guidance and around the need to physically distance up to 6 feet with our older kids in middle school and high school. And we talk about the limited amount of spread that is occurring in schools, and it really is not. And part of that is because we are actually following all the health guidance, including physical distancing. So if we didn't physically distance, we would probably see more spread in schools. So I don't see that hybrid model changing until health guidance changes, which I don't imagine will change until after there's widespread vaccination. And so I believe the hybrid model in one form or another is here for the long haul, specifically with our older students. Now, we also know it's not a perfect model, and we continue to get better across the system as we work on that. But given where we are right now, it's best to have kids in school as much as possible, as opposed to none at all. Thank you.
Okay, next we have Victoria in Centennial, and this is for Dr. Douglas with Tri-County Health. Victoria, you are live. You can go ahead and ask your question.
Thank you for taking my question. I am primarily aiming this question at Dr. Douglas, although I think that I continually hear from the superintendent that the spread is not coming from the schools, that no one, I heard someone, I believe Brian, say that not one case was contracted within the walls of his school district. I heard Scott Siegfried say that the spread was not from schools. And I'm just wondering, Dr. Douglas, how do you factually know that?
So, Victoria, it's a really fantastic question, and it's sort of at the heart of what we do. And the answer is that in an absolute way, we cannot know. What we do for students, teachers, and anybody else in the community is talk to them about their symptoms, who they've been in contact with since they got sick, and then their exposures during the calculated time when they would have caught the infection. We believe that's really our best way of triangulating the source of infection. In the majority of cases, we do come up with a source of infection, but this is sort of the approach that's really used for most infectious diseases, where you don't really have, except in very isolated circumstances where someone is very sequestered and it can only come from one place, know that absolutely.
Hear the rest of the question.
Next, we have Monica. Monica's question is aimed towards Amber. Monica, you can go ahead and ask your question live.
Why, thank you. I'm actually a parent, and Dr. Siegfried is actually my superintendent in Cherry Creek Public Schools, or Cherry Creek School District, and I just want to say what I have been proud of his work before, but I'm very proud of how he's taken this on, and he has put the district and the children and the teachers first, and it's very difficult to navigate through. I actually am a parent, and I contracted COVID in March. It is probably the best thing I can say for any parent who is concerned about how their babies are navigating. I've got sick with both of my children at home, and neither one of them were positive, nor were they asymptomatic. This is a virus, and the good doctor can probably attest to what we've known, is difficult to track. But one of the things that people need to be mindful of, it's vicious and it's violent, and it's literally every single system in your body is fighting against itself and fighting against each other for its own survival. And your body is the battlefield, and that's probably the best definition that I could possibly give. And then there's the aspect of different symptoms and whatnot. But as I see what for the doctor, and this can actually be for any of the superintendents as well as you learn, what have you found out about the education to parents about being not only asymptomatic, but also the affect of the virus. I think we do a lot of talking about the prevention, which is very important. But once you get the virus, there's no stats that actually clarify about the people who were sent home on quarantine who survived and were never hospitalized. So a lot of the data we're getting are people who have been hospitalized on ventilators. So what other levels of, or layers of education are we doing in lieu of protection, but also in contract? How do you deal with the symptoms after? I'm sorry, I know that was really loaded.
So hi, Monica. This is Amber with AllHealth Network, the mental health resource. So I think some of that is certainly a medical question that is clearly out of my scope to answer. Nobody wants me trying to do that. But I think you raise a really good point about how do we talk to our kids, and there's so many different kinds of experiences. There's worrying about getting the virus, worrying about someone we know having it, dealing with the after effects, seeing people, not be at school and worrying and wondering why. And so I think those are all things that as parents, that fellow parent here, that really talking to our kids about, talking to teachers and our supports about just kind of what's going on and how do we talk to our kids in language that makes sense to them and with their age, and how to really kind of engage them in that conversation so they know what's going on and they have factual, correct information, but that they also have the information that's appropriate for their age. And I know schools do an amazing job really trying to help support with that education. Again, the public health department does a great job pushing that information out. And at Colorado Spirit, while we don't necessarily have that information to share in terms of talking with families about how to talk about that or things you're seeing and worried, we're always happy to be a resource. And if folks wanted to reach out to us, you could certainly call us at 720-707-6789. Thanks so much.
And Dr. Douglas, would you like to weigh in on that question as well?
Disconnected, I apologize. I didn't follow the question entirely, but I think I heard it was getting at some of the issues about symptoms in addition to the educational question that I think Amber very nicely answered. I will say that keeping all of us informed, whether it's parents or citizens in the community, is a constant challenge. We have worked really hard at that. I'm sure there's some ideas about how we could do it better. I think our schools have also done a fantastic job of reaching out to their community. Every time we've got something we want to try to transmit, they get it done within about an hour. I mean, they're really fast. I will say a couple things regarding the question. Number one, again, many people do get very sick. I like the metaphor you used about how our body sort of all systems are involved, and that certainly can be the case, number one. Number two, we are discovering that lots of people that don't get sick enough to hospitalize end up with what are called long haul or long-term sequelae, where people are tired or they have brain fog or they have trouble breathing. Thirdly, I would say that one of the pieces of good news in COVID is the hospitalization care has gotten much better. We heard a lot about that when the president was hospitalized, but frankly, some of the things he got have really improved hospital outcomes and reduced the death rate. So we're learning lots about a very complicated infection that can cause illness ranging from nothing at all to full-blown serious illness and death.
Great. Thank you, Dr. Douglas. All right. Again, if you would like to ask a question, just go ahead and press *3 on your telephone keypad to get into the queue to ask a question. Again, that's *3. Next, we have Michelle in Aurora, and this is for Rico Munn with the Aurora School District. Michelle, you're live. Go ahead and ask your question.
Hello. Thank you guys for doing this evening. My question is actually for Dr. Siegfried because I'm not in APS. And my question, he kind of answered, it's based on, how things go. But my question was, do you foresee school opening completely on a full-time schedule in the spring, since the data is showing that there's really no in-school virus transmission?
Be happy to jump in here. Am I unmuted?
Yep, go for
I
it.
can
We
hear
can hear
you.
you great.
Oh, great. Thank you. Thank you for the question. And, you know, my greatest hope, and hopefully it's becoming more of a belief, is that we could at least end the year with more normalcy than we've started this year or ended last year. But from my perspective, it's really a question for our health experts, and do they see health guidance changing so that we don't need to talk about up to 6 feet of physical distancing between older students and adults. If that changes, then we can absolutely have that conversation, and we would all love to have that conversation. But until that changes, our schools are built to have kids and teachers close together in small groups, and we're really not able to change that without that adjustment and guidance from the health department, and maybe Dr. Douglas can add to that. But I might also go back and maybe share a little bit of data about a question around how we know that COVID isn't being spread in schools. And I think Dr. Douglas maybe dropped off for a moment there. That, I can't guarantee, but the data I have is that we have this first quarter put 1,200 students and 125 staff members on quarantine for potential exposure. And in Cherry Creek, we have 6 students that became COVID positive during quarantine and 0 staff members that became COVID positive during quarantine. And that would tell me a little bit about correlation but not causation. I don't know that they absolutely got it from being in close contact in school, but I do know that they became COVID positive during that quarantine time. That's about a 0.2 to 0.3% of individuals that were potentially exposed ended up with COVID. And some of my other colleagues actually have smaller numbers in their organization. So that's the data we're pointing to when we talk about that. When we put kids and adults out, they're waiting their 14 days and they're coming back. And that's very positive. But now we're in this moment of we have to balance what's happening in our community with what we're experiencing in our schools. Thank you.
Wonderful. Thank you. And Dr. Douglas, would you like to weigh in on that?
Yeah, I think Superintendent Siegfried covered it very nicely. I would say I could see 3 things that could happen. Number one, we are learning a massive amount by simply our schools being in session, carefully monitoring what's happening with the matrix of different prevention measures they've taken. And honestly, I think the documentation of the low rate of transmission is going to lead us to potentially reconsider how much safer school could be. Now, that's going to be counterbalanced, as Scott said, by the rising rates in our community, which brings me back to my pitch of let's all do what we can to keep our rates as low as possible, because that gives each of our superintendents more breathing space and more chance to educate our students. The last thing I would note is, although I don't expect to see vaccines by Election Day, that's not very far away now, but I do think we've got a lot of progress made. And I think the idea that we may have vaccines that we begin to use for essential workers, healthcare workers, first responders, and actually teachers and school personnel are pretty high on the list, is reasonably plausible in the winter, with broader vaccination later in the springtime, maybe in time enough to give us protection to get our schools back. So I don't want to be a rose-colored glass kind of guy, but I'm looking at this stuff pretty closely, and I think it's reasonably optimistic that we'll be getting good vaccines that will help us in lots of places, including schools.
Wonderful. Thank you, Dr. Douglas. Next, we have Eric in Littleton, and this is for Brian Ework with Littleton Public Schools. Eric, you're live. Go ahead and ask your question.
Hi, thank you. I really appreciate the town hall and giving us in the community a chance to just have a conversation with the superintendents like this. I think it's really important. My question was also around the transfer cases. I believe what I heard was it's just non-existent right now. And I wanted to take advantage of having the mental health professional from, I think it was AllHealth, on here as well. So it's kind of a 2-part question to both parties. I have noticed, and several of the parents we've talked to, that with some of our kids, the academics maybe feel too easy and they're not challenged very much with the on-home part, but the part that is causing some issues is some of the social and loneliness issues. I think mentally, these kids seem like they're very much at an age where they are having to learn how to find themselves and other kids. They have similar interests, and they can't really do that. And I see like some things there. I think that COVID is very dangerous and it's important, So when we hear things with the transfer case is non-existent, I think opening up that middle school is what I'm looking for a forecast for.
So thanks, Eric, for the question. I think it goes back to what Dr. Siegfried said and also Dr. Douglas is that right now with the guidance that we have, even given the academic challenges that we're facing with these hybrid models and the social, emotional, and even behavioral issues that we're facing, is that we simply can't open up fully and have 2,000 or even 1,000 kids in these buildings that were never built to physically distance kids. And so whether or not the physical distancing is the primary strategy, I don't know, because we have been physically distancing our secondary kids. But I do believe that the masking is working. And one of the reasons that the superintendents are gathering all of this data, this internal data about quarantines and about cases and percentage of outbreaks, is simply to provide that back to our state and local health departments so that they can start analyzing it and make determinations about, can we relax the physical distancing requirements that are currently in place. I'm hopeful for that for second semester, but then you take a look at our community rates of COVID, and that is just simply not good. And so then how do we kind of square that? How do we get in front of our community and say, look, if you want our schools to be fully open, which they're not right now, we're going to need the entire community's help. I, too, am incredibly concerned about the impact of mental health on our middle school and high school kids in these hybrid models and even in our online programs, our fully online programs. I worry that they're not getting the socialization that they typically would have, and I also worry that even with masks on, our kids are not engaging the way they typically would. And I think that eventually, and I'm not a psychologist, I'm not a counselor, I'm not a therapist, but I think that we're going to have to deal with the fallout eventually of kids not having the opportunity that they otherwise would have of socializing appropriately and everything that goes with being a middle schooler and a high schooler. So I don't have great answers for that, but what I do have is a great mental health team in my school district. And they are on call 24/7, and they are making calls to parents, and they are checking in on kids. They are doing Zooms and Google Hangouts with kids that are struggling with kind of social and emotional issues. So if you know of any kids out there, please either reach out to me directly or to Mr. Nate Thompson, who is our Director of Social, Emotional, and Behavior Services, and we will make sure that we can begin supporting the families or specifically the students that are struggling in these areas, because I know it's real. Thank you.
And Amber, would you like to weigh in on that? That's Amber with AllHealth Network.
Yeah, absolutely. I hear the concerns. I mean, especially our middle school and high school kids, developmentally, we know they're really looking outside of the family to make social connections, and that has really shifted for them a lot. So I think in addition to staying connected with schools, like I absolutely agree with what was just shared, the schools have really strong mental health teams and reach out to them about concerns. I think as parents, keep connecting with your kids and talking to them about how they're doing. And I know I have a middle schooler myself, and he does not always want to talk to me, but checking in about what's going on, engaging them in conversations about what they can do and helping them find ways to engage. Are there activities that do feel safe and comfortable outside so they can still connect with friends on some level? Are there kinds of things online? My daughter is involved in Girl Scouts, and they've started doing lots of things. So she's found that she's gotten exposed to meeting girls from other places that she wouldn't have normally met. So I think, again, it's kind of that time as parents to really kind of work with our kids and try to get creative. And I get that that's hard on top of everything else. So really kind of reaching out to your networks and getting support, because none of us can do this alone. But yeah, definitely being mindful of the importance of those social connections. Thanks.
Wonderful. Thank you, Amber. And now we're going to go to Merlin in Denver. This question is for Wendy Rubin with Inglewood Schools. Merlin, you're live. Go ahead and ask your question.
Okay, is that me? Marilyn?
Yes, that is you.
Okay.
I'm sorry, Marilyn.
No,
someone wrote Merlin.
This is for Denver Public Schools, Superintendent. So, two things. I have a very close relative in D.C., the Department of Ag, who is doing this meal program to get children fed during this time. And I heard that at one of our schools, actually, it's Laurie, that there is a nice population there. And then there is this little pocket of special housing and the transportation. They can't get the kids there. So forget the fact that there is food at the school for them. The district, how hampered, question number one, is your transportation system, and why is that not addressing that population that needs to get to school? The second question I have, and that's having been a teacher in DPS for over 25 years, is that throughout everything, the money that comes from the amendments and the propositions never gets to the classroom. That is to say, these systems that we have, first of all, to get air conditioning, that was minuscule. But what are your plans for not only getting some air into many of the older schools, but these air filtration networks that as I think is as important as the vaccine business. Some of the vaccines, from what I understand, some are going to be better, some are not going to be as good, some are going to be. We've got to take care of our environment, the kids, for our students. So on those two questions, could I have an answer?
Okay, great. Thank you, Marilyn. Unfortunately, this telephone town hall is not for DPS. It's specifically for Arapahoe County. We appreciate your question, but you know what, Wendy, do you want to go ahead and try your best here since you're with Inglewood?
Sure. Yeah, I'd be happy to talk about what I do know is happening in Arapahoe County schools, and you know that my colleagues, their engagement around air filtration and those types of protocols. But we, when we received our stimulus money, I know many of us looked right away to see what type of, equipment and supplies were we going to need to help us get through this. And we all invested in much better air filtration. The actual filters, there's a rating called a MERV rating. It stands for Minimum Efficiency Reporting Value. And essentially the higher the number, the smaller the particles are that it captures. So if you have like a MERV 13 filter, that's something you typically see in hospitals and other areas where they need that really high level filtration. So many of us invested in vast quantities of these higher level MERV filters for our schools, and where our filtration systems, our HVAC systems might recommend that a filter be changed once a quarter, we're changing them monthly or even more frequently. And certainly if there's any kind of concern around any type of, if we were worried that there was potentially going to be spread in a school. So we really are very conscientious and very aware of the filtration in our schools, and how our HVAC systems really do play an important part in helping us keep students safe. With regard to transportation questions in DPS that I cannot answer, with regard to food service, what I can tell you is that the Department of Agriculture has actually now extended the benefits for school lunch and breakfast programs through the end of this school year. So that means that breakfast and lunch is provided to all students in all of our schools right now. And those of us who are engaged in remote learning at any given point in time or have students online, we have set up systems so that those folks can come in and pick up meals if they need to. In cases where students are quarantined, I know that we are actually delivering meals to those families if those families are unable to leave their homes. and I know that my colleagues are doing many of the same types of activities. So again, speaking for Arapahoe County schools and superintendents, I do know those types of actions are being taken regularly, and we continue to find new ways to make sure that we are supporting our families, with food, and making sure that they get what they need and that our kids are safe in schools. So there you go.
Wonderful. Thank you. Okay, next we have Matthew in Aurora, and his question is for Rico Munn with Aurora Public Schools. Matthew, you're live. Go ahead and ask your question. Matthew, can you hear us? Hold on one sec here. I'm not hearing Matthew right now. Let's go ahead and go to our next caller. We have Rudolph in Inglewood. Rudolph, you're live. You may go ahead and ask your question. All right, we don't have Rudolph either. Let's go ahead and go to Ilana. It's an online question, and she would like to know, for families that have opted to homeschool while COVID-19 is a concern, what plans do you have to help them come back to public school once COVID-19 is no longer a concern? And Patrick, if you'll go ahead and take that question.
Absolutely. We always welcome back our students anytime that they feel like they're ready to come back. We think that we have a safe environment for them. I believe that they're safe right now coming back. So once families feel safe and secure in re-entering the school system, we'll do everything we can to reach out to them and be sure that their child's needs are being met, and that we're trying to do everything we can to ensure that their safety for the child in the building and that their academic needs are also being met.
Wonderful. Thank you, Patrick. We're going to try Matthew one more time. Matthew in Aurora, can you hear us?
Yes, I can hear you. Can you hear me now?
Oh, great. Perfect. Yes, go ahead and ask your question for Rico.
Thank you. Mr. Munn, I've been involved in a couple of the chalk talks that the people in Aurora Public Schools have given out. And one of the things that they pointed me towards as a parent was your guys' decision matrix for Aurora Public Schools. And I noticed that this decision matrix is only updated every 2 weeks. Now, data takes time to develop, and the CDC and CDPHE, they daily track COVID numbers and running averages. They have great statistics. How come Aurora Public Schools is not taking advantage of this running data to keep their decision matrix updated daily so that they can make better decisions on trends?
Yeah, and Matthew, thank you for your question. For those of you who aren't familiar, in APS, we adopted something that we call the decision matrix, which is a measure of about 9 different measures that takes a look at who's making the decision around schools being open and what data we're looking at. And what we're trying to do is create as much stability in our community as possible. And so we want to make sure that people understand that every 2 weeks we are formally kind of communicating with the community about what the status is and what's happening. I can assure you we look at the data every day, all day. And if we need to make a quicker decision, we certainly will. But we wanted to make sure that the community had a regular, consistent source that they could look at to see what we're looking at. And our metric is not a health document. It looks at everything from our supply of PPE to our average daily attendance to our own internal building readiness. And so when you look at all those measures across those different multitude of measures, we wanted to just make sure that we had the appropriate frequency to update that and to give people some stability in understanding our decision process.
Wonderful. Thank you. Okay, next we're going to go to Rudolph in Inglewood, who has a question for Tri-County Health, Melissa Sager. Rudolph, you're live. Go ahead and ask your question.
Can you hear me now?
I can hear you great. Yes.
Okay.
Thank you.
Okay, I have no clue what happened last time. This is basically a sporting question and after-school ECA question. What are the current protocols for each school area? Because with sporting events, it involves each individual school against each individual school. And as far as the after-school ECA programs, what's going on with that? And are there any backup contingencies in case things go south?
Can you expand on that plan briefly? I'm not familiar.
Well, as far as sporting events, I know football has been delayed for most of the district and most of the county, and each school, well, there's it's a competition thing. As far as I'm aware, even my grandson wants to get involved in sports, but he's not sure if he is in a safe place to do that yet. I'm pretty sure each district has their own set-up plan. But
that is correct.
Okay. Now, what are the current plans overall for sporting events and after-school ECA programs? Are there any active ECA programs at this time? And is there any backup plans in place, or will there be any backup plans in place, I should say, should things change COVID-wise?
Absolutely. Thank you so much for the question. It is going to be very case dependent. So like you said, each school district, even schools, will have their own set of rules depending on their capabilities, what works for their staff and students, and what they're able to do safely. So it is going to be very case dependent. And for those arts and cultural activities, that's the same. It's going to depend on whether or not the school feels safe to host students in person. When you host additional groups in person, that means they have additional contacts. So you have to take that into account and be careful. But it is going to depend on the individual school and school district. But we know a lot of our schools have implemented a lot of safety measures to keep kids safe to engage in activities. We encourage you to reach out to us at Tri-County and your school district to see what they're doing, and to check out the guidance available online at tchd.org to see what protections are required to be in place, so you know that your school is doing those and that you're feeling safe to participate. But do reach out. We're happy to provide more information on that.
Wonderful, thank you. And we've enjoyed this time with everyone tonight. We are at the end. I hope you have found it useful. But before we leave, we'd like to bring on our county commissioners on the line just to wrap things up for us. So first we have Commissioner Nancy Jackson. Go ahead, Nancy.
Thank you. And thanks to all of our guests who attended tonight and gave us so much valuable information. And thanks to the literally thousands of you who tuned in and asked so many important questions. As we continue to determine the safest paths forward for our schools, we welcome your continued input. And we know that these are really complicated questions with very few easy answers, but we hope we've at least helped to clarify a few things for you. So continue to let us know what's on your mind, and we'll keep doing our best to make sure that we're keeping everybody as safe as possible. And now, to close us up, Commissioner Holen.
Thank you, Commissioner Jackson. I want to also echo the appreciation that the county commissioners have at our important guests and the difficult task that both administrators and Tri-County Health and AllHealth Network are facing to find solutions to many of the issues that are pertinent to this pandemic. I want to thank all the people that called in. Those who have not got their questions answered, we'll try to answer those online. And I want to thank again everybody who participated tonight. and particularly our constituents who we hope have been able to answer your questions and provide you advice and alternatives to deal with those issues that you brought forth. Again, thank you very much, and good night to everybody, and be safe. Follow wear your masks, social distancing, washing your hands. That's the only weapon we have now to put this terrible pandemic to bed. Thank you.
Thank you, Commissioner, and thank you to all of our commissioners and everyone on the panel today for joining us. Be well. As a reminder, we will post a copy of this recording to our website in the next 24 hours. Have a great evening.